Okay. Good evening, everyone. Thank you for joining us. My name is Melanie Ionese. I'm my physician relations specialist here at Rothman. Tonight's webinar is with Dr. Michael Rivlin, hand and wrist surgeon. Office locations are Marlton, Bensalem, and Center City. Topic that he'll be covering this evening is artificial intelligence and 3D technology in orthopedics hand surgery. In this lecture, he'll be discussing the latest orthopedic innovations, including artificial intelligence and 3D technology in hand surgery. Learn how these cutting-edge tools transform patient care, from diagnosis to personalized treatments and surgical advances. This lecture is perfect for anyone interested in the future of orthopedic surgery and how these advancements improve outcomes in hand and wrist procedures. Just a few quick notes. Feel free to ask any questions you would like at the Q&A icon at the bottom of your screen, and we'll get to as many as we can towards the end of the lecture. Also in the chat box, I will show Rothman's phone number and also my email if you have any questions after the lecture. The webinar is being recorded and will be sent out to you in 7 to 10 business days. So without further delay, a great thank you to Dr. Rivlin for giving us of your time this evening. So thank you.
Thank you, Melanie, for your introduction. I really appreciate all the attendees. This lecture or community program should be very fun and interesting. It's a little bit different. We're not going to be talking about, somebody's ailing knee, but really a perspective of orthopedics and how the future is. And we're going to touch a little bit about how the future is already now in Rothman and around the world. I encourage any questions, and again, as we said, please put them in the question box or the chat box, and we can answer all of them. So I'm going to jump right in and really start talking about the future of orthopedics. Let me just start my presentation. So again, my name is Michael Rivlin. I'm a hand and upper extremity surgeon at Rothman. My specialty is minimally invasive and AI-guided approaches. That's my passion. I do anything from elbow and below. My subspecialty also peripheral nerve surgery, so nerve compressions and anything like that. I enjoy trauma. Otherwise, I love the call of the future and how we can make today's technology better. So we have a little kiddo on the screen that has an injury, and our goal is to take care of every demographic and make sure that they can be treated in the best way ever. So we're going to talk about the future. And when we talk about future, we think of AI and 3D technology. Well, the AI is already here. We don't have to be afraid of it. We just have to know it, and we have to have it help us rather than hurt us. So many people heard AI, but really AI can mean a lot of things. So I'm going to give a tiny bit of a background of what artificial intelligence is. Artificial intelligence is really a statistical term. That means we're doing statistics, but every time we get the result back, we improve, we learn. So artificial intelligence is essentially a machine learning with statistics where every answer makes you better the next time you run the statistics. Artificial intelligence is not new. And again, without boring everybody about the evolution of AI, it started before the 1950s, where computers just surfaced, further designated by machine learning, when the machine can learn by itself without us teaching the machine how to learn, to deep learning, which means we don't even have to teach the machine how to learn. It just learned itself, which is called deep learning. We don't have to train it. It's like a child or a dog that learns basic things. A couple of terminologies. Again, machine learning in medicine is I show the machine what to look for on an MRI, for example. I teach it how to learn the MRI, and then we go from the MRI and let the machine understand it again. What deep learning is very different. Deep learning is I don't show the machine the MRI. I just tell the machine, here's the data, please find out what's wrong. And the machine has to learn by itself. That's called deep learning, which is the future. So after this lecture, you can actually have a conversation about AI. Now, I want to remind myself that I'm a surgeon. So there are certain things I don't want to let go. A surgeon is like a pilot that flies the airplane. And what innovation is, or artificial intelligence is the pilot is fed information constantly about maps, about GPS coordinates, about enemy territory, about what approach to take with the enemy aircraft, for example. The same thing happens with the surgeon. We are fed continuous information. What we do is we get better and better information. So what AI is not the AI doing your surgery, but AI is to improve my data as a surgeon so I can focus on the things I have to do with better reconnaissance. I'm going to use Dr. Dick Rothman's quote where he said, as a specialist, what you need is you need the right data so you can do the right thing. And you do the things that you're good at. Simplify process with simple, redundant approach, which means, for example, in the Boston Philharmonic, when there's a new musical piece, the conductor doesn't come and ask, "Hey guys, who wants to be on violin today?" Every day the violinist plays violin and the saxophonist, for example, plays the sax. I know it's a poor example, but it's not the violinist will try saxophone today and violin tomorrow. Everybody does what they're good at. And Dr. Rothman instilled in us that we are clinicians, we focus in one thing, and try to be very good at that. What AI helps us is to optimize the process. The AI and the new technology allows us to do it. So how is artificial intelligence work in our practice? Is that the future or is it now? Well, what important thing it does, it saves me time so I can spend more time with my patient. For example, we use AI to help with our documentation. Our documentation is very rudimentary. We have ways of just saying what we've done and typing notes, or we can have AI help us write notes of what happened in the patient visit. There is no amount of money that has been ever bought. Again, I'm sorry, no amount of money can ever buy a second of time, which is, again, we know it from movies. It is true. What AI does, it makes us efficient and we're able to provide better patient care. What else can AI do is optimize processes. For example, helping us schedule appointments, helping us with call centers, direct patients so they access us better. What AI can do, and again, this is a gentleman drinking out of a fire hose, it's sometimes how we feel when we have new patients. What AI can help us is streamline the patient experience. It makes the patients happier by getting the right information and match us with the right patient and patients with the right physician. So what sorting through the right patients means is figuring out, does the patient need me as a hand surgeon or does the patient need a spine specialist? And also, am I the right fit for the patient? Am I the person that the patient would benefit from or not? We actually have done a study to figure out whether AI is good at figuring out who should see what physician. And what was very interesting, artificial intelligence in our practice was actually very, very good. As a matter of fact, nearly identical to scheduling visits for the right provider rather than going to the phone line and waiting forever. So patients scheduling their own appointments with me, for example, did just as good at figuring out if the patient needs me with the help of AI rather than needing a spine specialist. So again, it led to the same surgical outcomes, which means we can help patients streamline the process of getting us to see. And yes, you can make an appointment with us online. AI can sort through a lot of things. It can help us to see if it's the right patient or does the patient need to go to the emergency room, whether it can wait or it's urgent, whether it prompts us that, hey, by the way, this patient needs a test before seeing a certain specialist, and triaging the patient to optimize patient flow, to have complex patients get certain amount of time versus simple things that just needs an injection get better access to physicians. Now, again, artificial intelligence combined with televisits, we still do televisits for now, can be helpful for patients. Again, virtual consultations are coming. Again, it's different than AI, and I'm sorry for the crude example, but yes, it's not for every field. Luckily, I'm a hand surgeon, so I can look at hands over video, but some other fields are not as lucky as doing televisits. Um, AI eventually can help make my front desk more efficient. Again, checking insurances and all the nitty-gritty that you get asked in every single office can be optimized, and we're working on it. It can help my nurse or even replace certain physician extenders, figure out what needs to be done, medical assistance, and scheduling surgeries. Those are all coming. Patient access, I think, is a key. My communication can be improved with patients by the AI figuring out what has to go to my nurse, what has to go to my medical assistant, what is a billing question, and overall employ the AI to help us. Billing and approvals can also be helped. For example, MRI approvals are very difficult. It gets challenging because of insurance companies every single day getting MRIs approved. AI can help us because AI has the algorithm to know what insurances do. And it helps the radiologist. I'm not saying they're going to get replaced, but AI tools can find fractures that radiologists cannot find. And that is getting better and better. Now, I'm a surgeon. Will I ever have artificial intelligence in the operating room? Well, maybe. So there is AI in the OR. As a matter of fact, it already does exist. We use AI in preoperative planning, in some basic assistance in complex surgery, in training our residents how to do surgery so they can have a simulator. They can check wounds and other outcomes for patients to make sure they're doing well. We are joining an era of custom implants because my implant may need different capabilities than somebody else's, and even smart implants that can detect an infection or the fact that the implant is worn. So, certain things like preoperative planning, you can see that AI can reconstruct a lot of injuries. And yes, we deal with complex injuries. This is a patient that had a complex trauma, and reconstructing the wrist is difficult because we don't know where it started. And again, oops, sorry, that is not what I wanted to do. Um, those things may require more artificial intelligence to put back. So that's the video on the right, which is not working perfectly. On the left, you can see also a complex injury. This is a child that didn't develop the response correctly. Artificial intelligence can help predict what is the deformity and how can this child be helped if they develop the bones correctly so they have a stable wrist. So yes, predictive modeling, which is part of AI, can be already used. In the operating room, I'm sure you guys heard of robotic surgeries. Again, robots currently don't do anything that they're not told to do, but eventually they can help. As a matter of fact, I have worked on with another hand surgeon at Penn on one of the first robotic surgeries for microsurgery, which is when we reconstruct vessels that are smaller than a millimeter, or think of it smaller than an angel hair pasta, to put stitches in there with nerves fixed and vessels fixed that are barely visible to the eye, with sutures about half or quarter size of human hair. These things are about the limits of human skill. But robotic surgery, as an extension of my hand, we have done surgery. And again, this is not with humans yet, although that's coming in the next couple of months. We are able to fix things that before we couldn't do, such as replant fingertip injuries that were not replantable before, and even transplant hands for one person or the other that got injured and lost a limb. What really can be helpful is essentially visualization during surgery. And this is a picture on the right of somebody doing spine surgery while you're looking through a specialized glasses similar to the AI glasses or the Google glasses or the Apple released goggles that give you artificial I'm sorry, augmented reality, which is you're looking at the object, but there is something overlaying in addition to the reality. So augmented reality, such as you can see the CT scan, you can see virtual reality, which is not overlaying artificial design, but the entire surgery is in a virtual space, which can be done as well. We have used this technology for tumors to see where is normal tissue, where does tumor start, and where is normal tissue begin and end. Again, sometimes in clinical practice, it is difficult to tell with the naked eye what is abnormal, what is normal. With artificial intelligence and augmented reality, we now have tools that overlay the imaging studies such as MRI or CT scan on the patient's actual body. It also can help us be better. It can help us get perfect screw placements by improving the trajectory. And by the way, this is not the future. This already is happening. So these tools, although new, they are here to stay and they will continue to make us better. In hand surgery, we don't use it as much as in spine surgery, for example. But again, certain fractures in the hand, we already are starting to incorporate augmented reality for these. Now, one day you can imagine that we don't have a medical student or resident or a professional first assistant or another surgeon assisting us, but actually a robot. So this is not something that's currently happening. This is somewhat of the future, but the technology does already exist. For example, that surgeon that you can see on the left using augmented reality glasses or virtual reality glasses is actually operating on the leg. And again, this is a simulation. This is not real. However, in his goggles, he can see the assistant, which you can see as a human nurse dressed in something, but actually that assistant's hands are connected to a robot, which can hold retractors and do things. So that's how we interact with the world and how the world allows us to interact with things. Now, one aspect of augmented reality and AI is that we are not interacting with tissues. When we want to interact with tissues, we talk about 3D printing. 3D printing is something that we actually can create to fit the patient's anatomy. For example, custom implants. And these do exist. So this is a patient that had a complicated injury, and we can use a CT scan or a 3D scanner to check the anatomy. And with the AI or manual demonstration and modeling of the fracture surgery, we can actually create the implant the patient needs. This implant can be used to do simple or even complicated surgeries, things that are geometrically complicated. And again, this is not the future, it already exists. I use this technology for complicated fractures that did not heal well. What happens is we get a CT scan of the patient, we send it for analysis. Within a few days, we get analysis. I can do the surgery in virtual space, and then they create what we call cutting jigs. So you can see it on the bottom right corner, those green things screwed to a bone. That allows us to cut the bone in a perfect way. And then on the further right, you can see we can create a custom implant that goes in the wrist in this case to correct the deformity. These deformity surgery corrections are difficult to do without planning, and this takes the variability out by creating a simple system to be able to use. Switching gears a little bit, again, going back to the current, we do have other options besides surgery to create improvements in the patient. For example, this is my patient who broke his both wrists. He's a college freshman, and you can only imagine how it is to be a freshman with both broken wrists that he can get wet. Those casts are smelly, can have rash, and it doesn't hold well. We can't X-ray through it. And yes, you do need a cast sew to take off, which has its own issues and risks. Cast sew can cut people and burn people. And again, we try everything not to happen, but again, these happen. Today, we already have been switching to 3D casts and 3D braces, so we're able to have a completely customized experience for patients. These newer orthotics, which are mostly done in the upper extremity, but we do it now in the lower extremity and spine is coming as well, can provide patients comfort and the physical freedom to do anything they want within the limitation of their healing. And again, this is an improvement. These newer cast and braces are completely waterproof. MRI can go through it. You don't need a caster to take them off. It only takes a minute to apply and remove it in a second. They can be hygienic, cleanable, and yes, you can scratch within the cast because it has holes. It is great for athletes, adults, for kids, and anybody that needs a little bit more help, such as the geriatric population. It is currently available at many Rothman locations. They are waterproof, hygienic. It's covered by most insurances, and improved patient comfort has been proven with many publications that most of them came out of Rothman Institute. We can do a fully custom 3D casts. We can make 3D braces that are removable, and yet even carpal tunnel braces that fit perfectly, or semi-custom braces. The way this works is, again, it's all about acquiring normal anatomy. We have a 3D scanner which can capture the anatomy, and then after 3D scanning, which takes about 5 seconds, using laser scanning, the patient's cast is designed in a 3D space, and then using a 3D printer, we have the cast produced. We strive to provide casts within an hour soon, although it still takes usually within 8 hours or next day to get the fully custom 3D splints or casts. We are changing to providing these hopefully within an hour in most locations. So this is a little video about 3D cast that we do currently at Rothman. I'm not sure if you guys can hear the voice, but again, it's all about improvement, all about able to use the hand within the injury parameters. And again, we partnered with Dimension Ortho, again, just to play it one more time, to do 3D braces and casts. You can see a handheld scanner. And again, the limitations are almost non-existent with this technology anymore. So now it's fairly standard practice for kids that have wrist fractures to not miss a swim class. My own daughter was in a cast as she broke multiple fingers doing a rope course. She never missed a swim lesson or a swim class. She was in a splint or a cast for about a month and a half. And again, we have our own patients. These are something that are completely cleanable. This is actually a surgeon that broke his thumb. He was able to do surgery with a fully custom 3D cast that he had to wear for a while, and he was able to continue helping people. This is a little girl. She's a lacrosse champion. She had to continue to play with a broken thumb to be able to meet her scholarship, and she was able to resume the activities without an issue. We have some really complicated problems, such as very, very complex geometry with after surgical wound care problems. Now, this lady unfortunately had a fairly difficult break. She broke her elbow joint, which I fixed, but she also has a skin condition that she cannot heal skin, and all the skin peels off. And we were able to create a custom 3D splint for her to be able to still apply her skincare while providing stability. Being in a regular cast, she would not be able to heal her wound. So again, our goals are to improve everybody's function and able to provide the best treatment. And again, this is a quick review of how AI technology, 3D printed, and newer machine vision can improve all of our lives. So hopefully this served as a good overview of what's coming and what has been there, and I open it up for question.
Dr. Rivlin, thank you. Of course, I'm so very interested in all of this. I think this is just the future of so many things, and we appreciate all of your time for this. So question is, are robotics or AI-assisted systems being used in hand and wrist surgery currently?
Great question. So currently, we do use it in very limited cases, more for elbow surgery and complex elbow surgery. That is actually fairly rare still in hand surgery. The microsurgery is now gaining some traction. In Europe, they're doing a little bit more. We here at Rothman are on the forefront of it. The FDA approved a trial for only 5 facilities in the all of the United States, and we are one of them. So we will be the first ones to use super microsurgery with robotics. That is coming. I would say hand surgery, because of the delicate nature of it, is very different. I will talk about my joint colleagues. The joint colleagues use robotic surgery to, again, do much better. It has better outcomes. Many of my partners use it. I'm a little bit jealous and feel left out not to play with robots, so I'm trying to really make it happen. So yes, that's coming, but it's not the forefront for hand surgery.
I'm sure you will
Great
see
question.
it eventually, so that's for sure.
Yes.
Can AI predict recovery timelines or outcomes from hand surgery patients?
That's a phenomenal question. So here's the thing. We are working on predicting outcomes exactly as you mentioned. We are currently collecting data, and we have some preliminary data based on 3D scanning a hand without X-rays, without CT, without MRI, without anything invasive. We are starting to be able to predict wrist fractures and how patients do. Not only that makes us better, so we can now tailor therapy for the patients that we think needs a little bit push, or the patients that will require specialized skilled help. We now can synthesize all that data and give patient-specific findings. Yes, that is not quite in the forefront, meaning that we need a lot more research to do. And again, as you can tell, AI is my passion for research. We have even an NIH grant looking at this. We are working with the Department of Defense for this to try to improve even military outcomes for injuries. But yes, this will change our future. We will be able to predict how you will do a lot better using AI.
That's fantastic news. Do you envision this technology to be able to address conditions that have been truly untreatable? Example is bilateral radial ulnar synostosis, if I'm saying that right.
That is great. Wow, that's a very specific question.
Yes.
So just to answer a specific question specifically, radial ulnar synostosis is a problem. If it's not treated in childhood, biology does not allow us to have good options. So in a way, you can't fight biology. However, as that picture that I showed you about recutting the bone, some of those reconstructive surgeries, especially in radial ulnar synostosis, we can do better at improving function. And again, I can talk about it for an hour of how to position the hand with a new cut. We can predict with AI and 3D technology to improve a function if we have to do a corrective osteotomy for that specific disease. So the short answer, we can't fight biology, but we can make the most of it.
Thank you. Is Rothman Institute now using AI to assist radiologists with reading X-rays, MRIs, or CTs?
So we don't, just to be specific, we don't have our own radiologist at Rothman. We rely on Jefferson University or other health partners, because again, we are orthopedists. We do know that these facilities do have AI to help us. However, said that, we take our own X-rays, and we have multiple studies currently going on to have AI help us. In many other fields, it appears that AI makes the radiologist better. It does not replace them, but it cuts the time to make a diagnosis and creates less issues and less missed injuries. We are working on it. I think there is a future. If you were to ask me to predict it, I think every facet of human care will be helped by AI, so including radiology.
AI is going to be very busy.
Exactly.
How long does 3D casting last, and does it handle the same level of stress as traditional casts?
Great question. So we would never put, especially here at Rotman, we would never put anything on a patient unless we 100% vetted. So we have done 11 to 12 papers in medical literature testing to make sure we are not only as good as regular cast, but better. As a matter of fact, I will quote one paper. It's in kids and in the Journal of Pediatric Orthopedics. Between 8 to 18 years old, wrist fractures in kids. Patients with 3D cast did better than patients with regular cast. Why? We do think that a 3D cast fit better. It follows the anatomy better, the contour better. It also allows the patients to do more, so they get back to doing things faster. So yes, they are better than the current one. My family was a guinea pig, yes, but I would recommend it to all. Again, we want to make sure that we vet everything 100 times before our patients go on it. So these are fully FDA approved devices, but yes, they are better than the regular ones in many metrics. Plus, it doesn't
They look
stink.
a lot better than the regular casts.
Yes. So I've done many difficult things in my life, but when my 3-year-old broke his elbow and I had to bathe two kids in the same bathtub, and one of them could not put the other one underwater and not get it wet, I tell you that was super challenging. Having a 3D cast eliminates that issue. So yes, it is better for the user and the parent and everybody in between.
That is amazing. Is 3D printed cast more expensive than traditional option, and does insurance cover it?
Sure, great question. So most insurances cover this. Actually, it's billed in the same way as traditional orthosis, which means insurances do cover it. So it's an alternative. Most patients have approval. Everybody's different. So some patients have out-of-pocket costs, but by all means, we say that we check your insurance and we tell you what it is. Most insurances do cover it. It is not anything different. And as a matter of fact, it streamlines the process. In many ways, it makes it easier and cheaper.
That's awesome. Well, Dr. Rivlin, and just be mindful of everyone's time. We just thank you so much for this evening. I did include Rothman's 1-800 number in case you guys would like to make an appointment. We're happy to assist. And also, you can always check our Rothman website at rothmanortho.com. We thank you so much for this great information. I learned a lot, and thank you for sharing with us this evening.
My pleasure. And I just want to answer one question that was great that I think just popped up.
Oh, yeah.
So this is from Thomas Grant, or Grant Thomas, sorry. I think I know who you are, and I absolutely welcome your question. Medical students can get involved in this. I think this is great. Again, there's ways. If you reach out to Melanie, I'm sure we can find a way. This is the future. I'm happy for the interest. I wish you guys all the best. Thank you for welcoming me to your homes for this innovation talk.
Thank you, Dr. Rivlin. Good night, everyone.
See you. Bye.